Well, good afternoon, everybody, and thank you for joining us. As Heather said, my name's Terry Boyd, and our topic of discussion today is arthritis. There are a lot of myths, a lot of beliefs, and a lot of misnomers regarding arthritis. So, I really want to start out by discussing what is arthritis. So, if we look, our definition is our next slide, and it's telling you what we're going to discuss. Our introduction talks about arthritis itself and what it means. Arthritis is a redness and swelling or inflammation in a joint. And of course, a joint is where two or more uh, bones meet. So there's more than 100 different types of arthritic diseases. There's rheumatic disease, which includes the conditions causing pain, stiffness, swelling in the joints, muscle, tendons, ligaments, and bones. Arthritis is usually ongoing or it's chronic. What that means, it is long lasting. Arthritis and other rheumatic diseases are more common in women than they are in men, and they're also linked to our progressive age, but they affect people of all ages. There's juvenile rheumatoid arthritis as well. Next slide. So, when we talk about arthritis itself, what is it? Well, it's a general term for a group of different conditions that cause that joint pain and inflammation. The specific causes of arthritis can vary depending upon the type of arthritis that you have. An arthritis joint will demonstrate narrowing of the space between the bones as the cartilage starts to thin. It wears down. Bone spurs on the edges of the joint, small cysts within the bone, and sometimes deformity of the joint can actually cause crookedness or distortion of that bony area. Arthritis and other rheumatic diseases are common conditions that'll cause the pain, the swelling, limited movement, and affect the joints and the connective tissue all over the human body. So you can see different types of arthritis in the knees, in the elbows, in the hands, in the feet, and other areas of the body that may have been affected with injury in the past. So we're going to talk about the two most common forms of arthritis in this discussion today. The first being osteoarthritis, which is a common type of arthritis that is a disease of the joints, especially the weight-bearing joints of the knees, the hips, and the spine. Of course, our knees, our hips, and our spine are the supportive areas of the body that help to support the full body's weight. It destroys the coating on the ends of the bones. This osteoarthritis does. And it causes a narrowing in the spaces between our joints. It can also cause bone overgrowth, bone spurs, and reduced function. Most people exhibit that reduced function, and a lot of it is because of pain. It occurs in most people as they begin to age. It also occurs in young people because of an injury or overuse. You hear young men talk about having arthritic joints because they played football in high school or college and had injuries. People who play tennis and racquetball will have arthritis in their elbow joints. And so osteoarthritis is something that is very common. Now, there's rheumatoid arthritis. This is an inflammatory disease of the joint lining. The inflammation that occurs affects all of the joints, and it can also affect the organs such as the heart and the lungs. So there are other forms of arthritis or related diseases. Gout is one of those. It's a condition caused by uric acid crystals that build up in the small joints, such as the big toe, and it causes pain and inflammation. Lupus is another chronic autoimmune disorder that causes a periods of inflammation and damage in the joints as well, and it causes tendons and organ damage. Scleroderma, another autoimmune disease that causes thickening and hardening of the skin and other connective tissues in the body, which can lead to that same stiffness, pain, and inflammation. Ankylosis or ankylosing spondylosis. This disease causes the bone of the spine to grow together. Those bones fuse. It can also cause inflammation in other parts of the body. It can affect the shoulders, the hips, the ribs, the small joints of the hands and the feet. And last but not least, juvenile idiopathic arthritis, or JIA, or juvenile rheumatoid arthritis, JRA. It's a form of arthritis that is found in children that causes inflammation and joint stiffness. Children often outgrow juvenile rheumatoid arthritis, but it can affect the bone development and growth in children, at times leaving them with gaps in their growth plates, having them to be small in stature, and having some uh, form of deformity of the bones as well. So, what are the signs and symptoms? Each person's symptoms may vary. They can be very different, but the most common symptoms include pain in one or more of the joints that doesn't go away or comes back frequently, warmth and redness in one or more of the joints, swelling in one or more of the joints, stiffness in one or more of the joints, trouble moving one or more joints in a normal way. And these symptoms can look like other health conditions. It's important that you know the first step is always to be seen by your healthcare provider for a diagnosis. So, when we talk about the causes of arthritis, the cause can be very dependent upon the type of arthritis. Osteoarthritis is caused by a wearing and tearing of the joints over time or because of overuse. Now, rheumatoid arthritis, lupus, and scleroderma are caused by the body's immune system's attack on the body tissue. Gout is caused by a buildup of crystals in the joints. Some of these crystals can cause that joint to erode, leaving the individual with the same type of inflammatory processes you see in other types of arthritis. Some forms of arthritis can be linked to genetics or genes. People with genetic marker HLA-B27 have a higher risk of ankylosing spondylitis. For some other forms of arthritis, the cause is not known. So again, the cause may vary. And so to determine, what caused an arthritis is really dependent upon the type of arthritis itself. Next slide. So what are the risk factors for developing arthritis? And with this, we're talking about the two most common types, the osteoarthritis and the rheumatoid arthritis. One, and a very significant risk factor, is weight. Being overweight or obese can cause damage to the knee joints. This can make them more likely to develop osteoarthritis. The body is not designed to carry the weight that's being pressed upon them, especially in the weight-bearing joints, which causes erosion of those joints. Injury. A joint that has been damaged by an injury is more likely to develop arthritis than other joints. Infection. Reactive arthritis can affect joints after an infection. For example, if you had cellulitis or cellulosis of the knee, that then puts you at a greater risk for developing arthritis in that area. The work you do. Work that involves repeat bending or squatting can lead to knee arthritis. And then there's some risks that we have no control over whatsoever. The first one being our age. As we get older, we're more likely to develop arthritis. The joints are no longer capable of bearing the same kind of weight they did when we were 19 or 20. Gender play a role. Women are more likely to have arthritis than men. We're not quite sure why, but that has been statistically proven. Heredity. Some types of arthritis are linked to certain genes. So there is a genetic component to the risk for developing arthritis. So, how is arthritis diagnosed? Your primary healthcare provider will take your medical history and give you a physical exam. He or she may also order certain tests. They include blood tests such as an anti-nucleic antibody, an ANA test. This checks the antibody levels in the blood. There's a complete blood count. This checks if you have white blood cells, red blood cells, and platelet levels that are normal. If they are abnormal, this could be an indication that you are developing arthritis. Your creatinine levels. This test checks the kidneys for disease. Your sedimentation rates can help to identify inflammation. And of course, arthritis is an inflammatory disease. Your hematocrit. This test measures the number of red blood cells. Do you have sufficient or an overactive number of red blood cells in the circulating in the blood vessels and collecting in the joints? A rheumatoid factor and a salicylic citrulliminating peptide. I'm used to just calling it a CCP, guys. I apologize. These are antibody tests, and they help to diagnose rheumatoid arthritis. They can also assess the severity of the arthritis itself. And go. Shh.
We can't hear you anymore, Terry. You're on mute.
I'm so sorry I hit that button by accident. The you heard me mention the RF and the CCP. Am I correct? The RF, which is the rheumatoid factor, and the CCP, which the cyclic citrulliminated peptides, are antibody tests. These help to determine if there are indications of rheumatoid arthritis. And also, the levels help to determine the severity of the rheumatoid arthritis. White blood cells check the level of white blood cells in the body, and our white blood cells are our fighter cells. They help to identify and destroy infection. Uric acid. This helps us to diagnose the gout. The amount of uric acid in the joints can be an indication of the development of the gout disease. Next. All right. There are other tests that can be done as well. Joint aspirations or arthrocentesis. Arthrocentesis is not a fun thing to have to do, but a small sample of the synovial fluid and that's the fluid that's in the sac between the joints, is taken, and it's taken with a large bore needle, and it's tested to see if there are crystals, bacteria, or viruses present. There are other tests as well, such as x-rays or imaging tests. These can tell how much damage there is in the joint. Urine test, again, we're checking for protein and different kinds of blood cells. If there is an alteration in the blood cells or a buildup of cells of a particular type, that can also be an indication that we have the development of that inflammation or that inflammatory process. Of course, then too, there are muscle biopsies. These are tiny tissue samples that are removed and checked under a microscope to determine whether or not there's damage to the muscle. And this helps us to diagnose conditions that affect the muscle tissue itself. Next slide, please. So, how do we treat arthritis? Again, the treatment is going to depend on your symptoms, your age, your overall health conditions, because there are certain things that are done to treat arthritis that as we get older, we're not able to do. A treatment plan is tailored to each person, his or her health, age, and their level of conditioning. And there is no cure for arthritis. The goal of treatment is to limit the pain and reduce the inflammation in the joints, which helps to ensure joint function. And the treatment plan is generally going to be both a short-term plan and a long-term plan. Because the arthritis is not curable, short-term, the goal is to increase or to regain mobility, and long-term is to maintain that mobility and stability. Next slide. So what are the short-term treatment plans? Well, of course, you have medications that relieve pain and inflammation, such as acetaminophen or Tylenol, aspirin, ibuprofen or Motrin, or other non-steroidal anti-inflammatory medications. These are designed to reduce the inflammation in the joints. There's heat and cold. Pain may be eased by using moist heat, such as warm baths or showers, or dry heat, like heating pads, or even rice bags. But rice bags is something that's been used here recently. And what happens with that is you have a sack that looks similar to a sock, or I've had people to actually make a rice bag. And all you do is take uncooked rice grain, put it in a bag, heat it in the microwave. It doesn't actually cook the rice because there's no moisture to absorb, but it holds the heat long enough that placing that sack on the area of pain helps to reduce that pain. And sometimes you can manipulate the rice in a way that it covers the area better than a flat heating pad would. So that's just some information from me to you. Now, pain and swelling can also be eased by cold with either cold packs wrapped in a towel. Other people can actually do ice massage. An ice massage is generally, especially when it's done at home, is something that's done very simply. Um, my recommendation is using a styrofoam coffee cup, filling the cup 2/3 of the way and putting it in the freezer. Once frozen solid, peel back a portion of the cup so that the ice is exposed. The styrofoam cup allows you to hold the ice without your hand getting cold. And then you can use that to rub the area of pain and inflammation with the ice. Now, massage works as well. Before we get to massage, joint immobilization. The use of splints and braces can sometimes help, and support uh, devices such as the athletic braces that are used. And these help to rest and protect the joints from further injury. Okay, massage. The light massage of a painful muscle can increase blood flow and bring warmth to the muscle. Now, deep tissue massage is generally not recommended in areas where you have arthritis because at times that can cause more damage than a help. There is transcutaneous electrical nerve stimulation or TENS, and the pain may be reduced by the use of these devices. The device itself sends mild electrical pulses to the nerve endings, and that helps to reduce the pain. This blocks the pain signals to the brain and changes the pain's perception. Last but not least, acupuncture. This is the use of thin needles that are inserted in specific points in the body, and it stimulates the release of natural pain relieving chemicals by the nervous system itself. The procedure's done with a licensed healthcare provider. It's very interesting, too, how acupuncture works because needles can be placed in one area of the body that actually stimulates brain activity to a different area of the body, releasing these chemicals and reducing this pain. Next. So, what are the long term treatments? Well, they include disease modifying anti rheumatic drugs. These are prescription medications that slow down the progression of the disease and create a treatment for any of the immune system problems that are linked to the disease. An example of these is methotrexate, hydroxychloroquine, sulfasalazide, and this one is hard for me to pronounce, but it's chlorobutyl. These medications are designed to help slow the progression of an autoimmune disorder. Now, of course, an autoimmune disorder is the acting of the body attacking itself. So these medications are designed to quiet the body's own reaction. There are corticosteroids. Now, these corticosteroids reduce the inflammation and swelling. These are medications like prednisone, and they can be taken orally or sometimes they're injected into the joints. Now, the one thing that's important to know is that corticosteroids automatically cause an increase in the blood sugar levels. It also can cause a significant increase in hunger or appetite. So, people who are on long term steroids can be more susceptibly at risk for diabetes and weight gain. The hyaluronic acid therapies. Everybody's heard of hyaluronics because of the treatments for skin conditionings. But this is a joint fluid that appears to break down in people with osteoarthritis, and it can be injected into the joints, such as the knees, to help relieve some of the symptoms. And then, of course, then the treatment of last resort is going to be surgeries. And there are many different types of surgeries related to arthritis. Depending upon which joints are affected, certain options are available, and surgeons can do arthroscopy, they can do bone fusion, or even joint replacements. Of course, as we know, of complete knee replacements, hip replacements. Um, Full recovery after surgery generally is going to take anywhere from about 6 to 8 months. And a rehabilitation program after surgery is probably one of the most important parts of that treatment. Next slide. So, who's on the treatment team? Arthritis treatment can include a number of different kinds of providers. And so it's important for you to know who these are. An orthopedist or an orthopedic surgeon, they're the individual that do the surgery, of course. A rheumatologist. Now, a rheumatologist is looking at the genetics and the areas of inflammation. Psychiatrists. Believe it or not, psychiatrists are often used to help with pain reduction, relaxation, decreased stress, all of which can exacerbate or increase the pain that you feel in the joints with arthritis. Your primary care doctor, your family medicine, or internal medicine physicians are a part of the team. A rehabilitative nurse is part of the team. Dietitians, because knowing what to and not to eat that can cause aggravation is going to be very important. A physical therapist, an occupational therapist, a social worker, a psychologist or psychiatrist, recreational therapist, and vocational therapist. And most importantly, the most important member of the team is you. All of these individuals inclusively work together to treat the disease. Next. So, what are some of the complications? Because arthritis causes joints to deteriorate over time or worsen, one of the biggest complications is disability, immobility. It can cause pain and movement problems. You may be less able to carry out normal daily activities and tasks, such as walking to the restroom or to the refrigerator, preparing meals, and things of that nature, dressing yourself. If the arthritis is severe in your hands, you may not be able to button or zip your own clothes. Next. So, when we talk about foods, it's important to know some of the recommendations for foods that we should eat. So there's a list that is posted, and this was actually obtained through the Johns Hopkins Hospital, and it indicates the 10 best foods to eat for people who have arthritis. Broccoli is one of those, and it's because it's loaded with antioxidants and anti-inflammatory substances. And we want to reduce those inflammatory areas, so broccoli is a wonderful choice. Olive oil causes suppression of the inflammatory genes, which then again can help to reduce the inflammation. Blueberries ward off inflammation and oxidative stress. Fish is an important source of our omega-3 fats, and those help to fight cancer, arthritis, heart disease, and even more. Nuts have another inflammatory process that helps to anti-inflammatory process that helps us to fight off the inflammation. Tart cherries, they contain antioxidants and they also have a powerful anti-inflammatory ingredients. Kelp, it contains a complex carbohydrate which contains anti-inflammatory processes. Fermented foods contain a bacteria that reduces systemic inflammation, things like sauerkraut. Papaya is loaded with a rich source of antioxidants that help fight inflammation. And there's green tea. And it's been shown that green tea can naturally increase the anti inflammatory substances that we already have in the body. So, the five worst foods for us to eat for arthritis and joint pain. Number one, first of all, sugar. For a person with arthritis, we need to be very, very careful about the amount of sugar we take in, much like that of a diabetic, because sugar releases cytokines, which significantly damage the inflammatory system, meaning it causes the inflammation to be worse. Nightshade vegetables. I didn't know exactly what they meant by nightshade vegetables until I did this research. And what they're talking about are things like potatoes, tomatoes, peppers. They can cause worse arthritis because of the way they affect the calcium metabolism in your body. French fries and other processed foods are things that we need to avoid. They release toxic chemicals in the bloodstream from the trans fats that they're prepared in. Blackened and barbecued foods often contain products from the foods cooked at high temperatures. That also would then refer to things like deep frying. Glutens, bagels, muffins, and pastries. They contain large amounts of carbs, which convert to sugar, which then in turn increases the inflammatory process. So that we know things that we should have are the healthy vegetables, and the things that we shouldn't have are fast foods, blackened foods, lots of carb foods like pastries, muffins, cakes, cookies, and pies. Next slide. So we know that arthritis is a chronic disease and that there's no cure for arthritis, but it's important to help to keep our joints working, reducing the pain and inflammation. So work on a treatment plan with your healthcare provider that can help to include medications and therapy. And this work plan together can help to slow the progression of the disease, help to provide some pain relief. And it's going to be important that you work on lifestyle changes that can improve your quality of life. Those lifestyle changes are one, weight loss. Extra weight puts more stress on the body's weight bearing joints, such as the hips and the knees. The need for exercise. Some exercise may reduce the joint pain and stiffness. That includes swimming, walking, low impact aerobic exercises, range of motion exercises, stretching exercises. These can also help the joints remain flexible. At this point, I'm also going to put in a pitch for one of the classes that we provide at Health Texas, and that is our Matter of Balance class. That class is an 8-week course designed to help to increase strengthening, flexibility, and balance. So if you are interested in that information, we can provide you the phone number to schedule for one of those classes. Activity and rest are important when living with arthritis. Activity and then rest help to reduce the stress on the joints. You should switch between activity and rest. Um, a lot of us like the rest part a lot better than we do the activity part, but we should actually do both. This can help to protect your joints and lessen the symptoms of arthritis. The use of assistive devices such as canes, crutches, and walkers can help keep the stress off of the joint and improve your balance. Using adaptive equipment such as reachers and grabbers can help you to extend your reach and reduce the strain caused by stretching beyond the point of normal rotation. Dressing aids help you to get dressed more easily. The management of our medications is going to be important. Long-term use of some anti-inflammatory drugs can lead to stomach bleeding. So it's important that you Coordinate with your primary care provider to create a plan to reduce the risk of stomach upset. And sleep issues, such as attention deficit hyperactivity, can increase the risk of snoring, sleep apnea, and stressless leg syndrome. It can also disrupt the body's circadian rhythm, which makes it difficult to fall asleep and stay asleep and then waking up at regular hours. And that rest is vitally important for the growth of healthy tissues, especially in the joints. Next. So, how do we support people with arthritis? Well, during Arthritis Month, wearing blue, which is the official color of arthritis, providing or promoting arthritis awareness. We support the Arthritis Foundation, the Arthritis Foundation for Juvenile Arthritis, and the camps that they provide. Juvenile arthritis, I'm having difficulty talking today. Juvenile Arthritis National Conferences, JA Power Packs, and Connect on Campus are all juvenile arthritis programs, and they're available throughout the country and within specific areas. Hosting or attending local campaigns and events is also very important because we show our support in developing legislation to help these foundations to include funding. So all of these things help to support the arthritis awareness and treatment for individuals with RA. Next slide. So I want to address some of the questions that were posted. And then I will take questions from the audience. What is the best way to relieve pain from arthritis on the knees? Well, of course, one of the things we talked about was the short-term pain relief and the inflammation that is caused by this. So what we want to do is to make sure we're using non-steroidal inflammatory drugs such as acetaminophen, aspirin, ibuprofen, or other non-steroidal anti-inflammatory medications. What meds are beneficial for us? Again, those we just mentioned: acetaminophen, aspirin, ibuprofen. There are some other non-steroidal anti-inflammatory medications that are available, but some of those are not over the counter and must have a physician's prescription. So that's something that would need to be discussed with your provider. Does the insurance cover screening for arthritis? Now, that's a question I wanted to direct to Heather because I don't have that information as it relates to your plan. Heather?
So that's going to be, I'm not going to have that specific to everybody's plans because all the plans are different by employer. So, but typically you go to your primary care physician, and if they need to have you do an X-ray or an MRI, like when I had to go get mine for the osteoarthritis, I had to go get an X-ray, and so I did have to pay something, but it was because it fell under my deductible. So it really depends on the plan design with the employer.
Thank you. Okay, one of the other questions, what should I do to strengthen? Well, to strengthen the arthritic joints, we need to focus on low impact exercising. Again, one of the best recommendations that we can make, believe it or not, is swimming. Swimming doesn't provide the pressure on the joints that weight-bearing exercises do. But if you're not a swimmer, walking, cycling, range of motion exercises, gentle strength training. We're not saying go out and try to be a weightlifter, but small weights that help to challenge the joints without straining the joints help to strengthen those joints. Activities like yoga or Tai Chi, which help to improve flexibility and balance. Our Matter of Balance classes are also available. While doing any of these exercises, it's important that you consult your physician or physical therapist to help to design a plan that's going to fit your needs and your condition. And what can we do to relieve some of the pain? I think we kind of discussed that, but if I need to just kind of reiterate, heat and cold therapies tend to help. Um, Passive exercise, activity, and then resting, and the medications that we discussed. Those can all help to relieve some of that pain. Now, since this slide was created, there were other questions that were posted. And so I want to address some of those as well. One of them is everyone going to get arthritis, or is are is there a prevention that you know of? Well, because of certain types of arthritis being genetic, we can't say that every person is going to get arthritis, but the risk is much higher if there are other people in the family that have arthritis. One of the other questions is, how do I know if I have arthritis or not, or if it's something else? That physical history and that examination by the provider is going to help you to identify if it's arthritis and possibly even the source. Does your primary or a specialist diagnose you? Actually, you can be diagnosed with arthritis by your primary care physician, and he or she may then refer you to a specialist. Another one of the questions is, what things help people dealing with arthritis pain? There are a number of things that can be done for pain management. Again, we talked about that. That was medication, ice and heat therapy, focused activity, um, low impact exercising. What is the best home remedy? Best home remedy is a heating pad or an ice pack. And for a lot of people, chemicals, over the counter chemicals such as like biofreeze, icy hot, Bengay, they can provide some topical temporary relief of the pain. But before you start using a lot of those drugs, it's important you discuss that with your primary care physician, especially if you have other skin conditions like eczema, um, psoriasis, things of that nature. We've already addressed the best way to relieve pain. What we've addressed the question of what meds are beneficial. Now, there are prescription medications as well. And we talked about the injectables and the oral medications already. Should What should I do to strengthen? Again, one of the best things to do is swimming, is the low impact exercise. Walking helps. And what you want to do is start out slow, choose a distance that you can walk that does not cause you overexertion or severe pain, and then continue with repetition of walking that distance for a period of about 2 weeks. And then from that point, try to extend the distance as you can and moving further and further. That helps to promote strengthening as well. What are the signs and early detection? We'd already talked about that. What can someone do to help ease the pain without medications? Again, some of those short-term plans can help with that. So I think most of the questions that were posted were answered in the actual presentation. But at this time, if you have other questions that we did not address, um, please take yourself off of mute, and I am ready to take those questions now.
Okay, there's an individual did mention there's also topical cream meds, which I think you just touched on.
Right.
Um, and then somebody asked, are there any vitamins that assist with avoiding getting arthritis?
Well, actually, vitamin A is important because it helps with bone strengthening and structure. Vitamin E helps with the lubrication of the joints, which helps to slow or even possibly prevent the bone on bone. Um, Vitamin D, of course, provides calcium. You want the calcium for good bone structure. A lot of your dairy products do that. Um, Psyllium and zinc, those help also with the strengthening of the cartilage and the ligaments that help to support those bones and the weight that is placed on those bones. Any other questions?
No, that was the last of the questions that was posted. If you
Okay.
guys have any questions, you could either post more those in the chat, or you can take yourself off of mute and to ask if you have any further questions.
Any other questions, guys?
No, ma'am.
Well, then, if there are no further questions, I thank you for your time and this opportunity to provide you a little bit of insight into arthritis. Again, the primary focus is strengthening, pain reduction, and inflammation reduction. And so, this is something that you need to partner with your primary care physician to ensure that you have long lasting good health. Thanks again, and we'll see you at our next presentation.
Thank you guys for joining us. Greatly appreciate it. You guys have a good day.